Hello, I'm Dr. Todd Jackson, board certified ophthalmologist. Today we're going to be talking about treatments for dry eye. Just to review, eye surface, eyelids. The eyelids and adnexa, or the surrounding tissue, have various glands that help produce the tear film. The tear film protects the eye from the environment. The tear film consists of three different layers: an oily layer, an aqueous layer, and what's called a mucinous layer. During your evaluation of dry eyes, those three layers should be measured and your treatment should be targeted at the deficiency. Now, just to review, if you have a deficiency in the oily layer, the oil is secreted primarily by what are called meibomian glands. If your meibomian glands are not secreting their oil, there are a couple of things. So if there's no oil or reduced oil, either the gland is blocked or the gland has atrophied. Or there are no glands. The glands in the upper and lower eyelids, there's more in the upper than in the lower, somewhere between 40 to 50 of these glands in the upper lid and about 30 in the lower lid. They can become blocked and atrophied because of chronic use of the eyes. So every time that we're reading, looking at our phone, concentrating on something, we blink about 30% less. When we blink, the orbicularis oculi muscle that surrounds the meibomian glands does not press on that gland and allow it to secrete. Hence, the oil can get blocked up in the gland, causing local inflammation and atrophy of those glands. So, if there's no oil, we test, do a meibomography and meibomian gland evaluation to see if they're atrophied or blocked. Now, the treatment would be this. Number one, you got to unblock them. The only FDA-approved treatment for unblocking those glands is called Lipiflow. It's a device, Lipiflow. You can look that up online. Once they're unblocked, here's some things that you can do at the home. Warm compresses is one. Now, many patients come in and they're like, yeah, doc, I do warm compresses. I feel pretty good doing them. But they lack the second component, which is a massage of that gland after the warm compress. So the goal of the warm compress is to heat up these glands after they've been unblocked by Lipiflow. And once they're heated up, then to do a gentle lid massage, you can take a Q-tip and gently massage up on the lower eyelid or down on the upper eyelid. I recommend dry compresses, like with a Bruder mask. You can get that online. You can use it 250 times. It's made with some Medi beads. Another thing that you can do each day at home to help your glands produce better oil is using a high-quality omega-3 fatty acid. Now, in other words, that's fish oil. Now, when I say high quality, I mean fish oils can come in two different forms. One is an alcohol form, and the other is a triglyceride form. The triglyceride form is much more effective. Alcohol is digested by the liver. The body has a little bit harder time absorbing that omega-3 fatty acid if it's in the alcohol form. Most that you buy at CVS, Walgreens, Costco, Sam's Club are in the alcohol form, and they don't tell you it. An experiment that you can do is you can cut open the capsule, put it on a styrofoam plate. If after 5 minutes it melts it, then you have the alcohol form. If you have the triglyceride form, there's three companies I know of. PRN, Physician Recommended Nutraceuticals, is one. USANA has one as well. And Nordic, out of Whole Foods, also has the omega-3 fatty acids in the triglyceride form. And that gives the building blocks to this healthy oil. So by doing warm compresses, gentle lid massage, along with a high-quality omega-3 fatty acid each day, they'll help keep those glands flowing and help this top layer, this would be air, right? help make this top layer healthier and protect your eyes from the environment. Reduce symptoms of dryness, fluctuation in vision, redness, itchiness. Now, if you have an aqueous insufficiency, we can use artificial tears. So we're going to put this over here. Artificial tears, preservative-free. Also, Restasis is an FDA-approved medication for increasing tear production. So that's Restasis. Also, increasing your water intake each day, 64 ounces. Very holistic and natural thing that you can do to increase the aqueous portion of the tear film, supposedly. Now, with regards to mucin, we don't have anything to increase the production of this mucinous layer. So we're left with primarily the oil and the water. Thank you so much. Have a great day.